Thank you, everyone, for joining our latest National Survey of Early Care and Education webinar. We are excited to welcome some guest speakers today, people who have been using the NSECE data but are not part of the NSECE contract team. They've published very interesting work that we are looking forward to hearing about, and that we'll also ask them to reflect on the value of the data, some tricks and tips they've learned, and advice for others who may be using the data. Before we turn it over to them, I'll just make a couple of remarks. I'm Rupa Datta. I'm the project director of the NSECE. As I mentioned, we have some guest presenters. Marcy, Whitebook, and Bethany are at the Center for the Study for Child Care Employment at UC Berkeley. They will talk about their work first, primarily using to talk about the ECE Workforce, and then Greenberg of the Urban Institute will be talking about her work on centers and home-based providers, and I think even an additional paper that's not listed. If you have questions, we have muted everyone but the presenters, but please do use the chat function. It should be in your lower right corner. You can chat with the presenter, and we will take questions. We will let the presenters get through their initial remarks, and then we'll take a set of questions for Marcy and Bethany, a set for Erica, and then if we have more time, we will take more questions. Just a few words about the NSECE. We know from your registration information that some of you are quite familiar with the NSECE design as well as some of the findings that have come out, while others are newer to this study. NSECE is sponsored by the Office of Planning, Research, and Evaluation at ACF in the Department of Health and Human Services. Our project officers are Ivelisse Martinez-Beck and Anne Rivera, and NORC is the main contractor. We have partners in Child Trends and Chapin Hall, as well as a variety of really wonderful academics and other ECE experts in the research community. We hope you can see their perspectives throughout the work. The purpose of the NSECE is to provide information on ECE services available to families with children aged birth through 5 years, not yet in kindergarten. So that's the full spectrum of supply for children not yet in kindergarten. The characteristics of the workforce that are providing these ECE supply services, and then all households with children under the age of 13, regardless of whether or not they're using any kind of regular ECE. The 2012 NSECE was the first nationally representative data about ECE supply for more than 20 years. It brought together 4 integrated surveys that represent center-based providers to children not yet in kindergarten, home-based providers to children all the way up to 13, as I mentioned, households with children under 13, as well as the staff, classroom-assigned staff who work in center-based providers serving children not yet in kindergarten. And the key feature of the design was to not only be able to represent these 4 populations who are of great interest in and of themselves, but also to do that in a way so that we can understand how the local availability of care relates to the families in that location and their needs and preferences for early care and education. The NSECE, as you understand, there are 4 coordinated surveys, and so we have households on the left here. We're depicting our sampling sources. On the left, you have households, and from households, we learned about households with children, as well as what we call our unlisted home-based provider population. These are individuals who are providing home-based care but are not known to state or national agencies as ECE providers. For the most part, we won't be hearing about this work today, the household sample, other than a teeny little foray that Erica's work makes into the unlisted home-based provider side. So basically, we will be focusing today on the right-hand side of the graph the figure that you see in front of you, which starts on the very right-hand side with the provider sample from administrative lists, whether they're state, national, commercial. There are a variety of sources there. And we have from them center-based providers to children not yet in kindergarten, as well as what we call the listed home-based providers, who are home-based providers who are known to state and national agencies and were able to be found in administrative lists. So we will be hearing about the ways in which these two teams have used a variety of different data products from that right-hand side, from the provider sample side. But we wanted you to be aware that there are also household data and that the two can be connected through geography for a variety of interesting analysis. We wanted to make sure that everyone realized that not only was there a 2012 NSECE, which is what we'll be hearing about today, but we have also completed data collection on a 2019 NSECE, which repeated the full design of the 2012 study, including all 4 of the component surveys: household, center-based, home-based, and the center-based workforce. We expect to be starting to share findings as early as the spring of 2020, and data files should be available starting in the summer. As with the 2012 NSECE, we expect not only that there will be public use data files, but also that there will be a variety of restricted use data products, and I think both teams today will talk about some of the work that they've done using the restricted use mechanism. The public use data will be hosted in the Child and Family Data Archive, which is where the 2012 data already are available. Okay, so I think that those are all the introductory remarks we wanted to make. We are super excited to introduce Marcy Whitebook and Bethany Edwards.
Bethany and I, along with Leah Austin, have worked on these papers together, with Bethany leading the analyses. I'll begin sharing some of the highlights from the index, and then Bethany will then share highlights from the 2 other papers. We will end by both weighing in on NSECE with regards to some analytic issues and some of the challenges about using NSECE data. So the Early Childhood Workforce Index, for those of you who may not know, is a biennial report that describes early childhood employment conditions and policies on a state-by-state basis. And it provides states with periodic updates and appraisals of their efforts based on measurable status and policy indicators. And the point of the index is really to encourage states to step up their efforts to address persistent workforce challenges. The inaugural index was in 2016, and we were very, very excited to have relatively current data from the NSECE about the characteristics of the workforce not available from the occupational employment statistics collected by the Bureau of Labor Statistics, as well as NSECE's relatively consistent data across the entire center-based and home-based workforce at the national level, and that also is really not available from the BLS. The data allowed us to answer some substantive questions regarding inequities among early educators that we knew about but were able to look at more closely. Sometimes local surveys will address or look at these issues, but not always. With the access to the public use data that was possible and restricted data that was possible for researchers after 2016 release, it gave us the opportunity for the 2018 edition of the index to really look more closely at the systematic pay disparities among members of the workforce. And so what we found were that that there were disparities by sort of funding type, which is somewhat an overlay with funding source. So the difference between Head Start, school-sponsored, and community-based public pre-K, and then other child care programs. We were also able to look at the disparities around the ages of the children served, under 3 or over, and how these disparities in pay layered on to the race and ethnicity of the educators. Bethany will sort of talk about how these three are more interrelated, but what we did find from this analysis was that nationally, overall, Black women in particular were more likely to work in the lowest paying programs and with younger children, and that was one of the sources of their pay disparities. But even after controlling for educational attainment differences, which you would see by role, African American educators still earned on average 78 cents less per hour than white early educators, which translates to about a little bit more than $1,600 less per year for a full-time, full-year worker. And, of course, these workers are very low paid, so that's a sizable amount of money for people. But when we finish the analyses, we recognize that a lot of what we see in, at the national level somewhat makes unclear what's going on at the state level, because we know that the states vary, very much with regard to demographics and also with regard to policies. And so we wanted to look more closely at these dynamics at the state level and to see, did the same patterns hold true. And so now Bethany will share highlights of our finding regarding these pay gaps in state contexts.
A little over a year ago, we published a report at CSCCE entitled California's ECE Workforce, What We Know Now and the Data Deficit That Remains. As Marcy mentioned, the trends that we see at the national level don't always hold state by state, and the NSECE data allows us to answer our research questions regarding stratification in the workforce for several specific states. This report, specifically focused on California, is a great example of the importance of state-level data and how policies based on national data can be ineffective or even harmful depending on the state context. For example, those working in California Head Start programs earned on average the highest wage we found with the NSECE data, and those working in community-based public pre-K earned the lowest wage. This circumstance differed substantially from the national picture, which we had looked at using the public use data, in which publicly funded pre-K offered among the highest wages. We highlighted several different data sources in this report, as you can see on the screen, such as the occupational employment statistics from the Bureau of Labor Statistics and several additional local studies. But it was the NSECE that offered the most comprehensive data set available on California's early education workforce, and was therefore the most helpful in responding to some questions regarding the ECE workforce as we await a more recent and comprehensive state and local information. In California, the least representative study of the last representative study of the California workforce was conducted in 2006, a period in which there have been tremendous changes in the economic and policy environment. Next month at CSCCE, we will launch the 2020 California Workforce Study, which will have a portrait of the workforce representative of all regions of the state, as well as 8 specific counties. As well, we're really looking forward to the 2019 NSECE, because that will be a great tool to examine the current landscape of the workforce in California that will capture various public policy reforms that have occurred since 2012, such as minimum wage increases and widespread implementation of the quality rating improvement system in California. I also want to quickly highlight another report we published that wasn't on the first information you received about this webinar, but this report is entitled Racial Wage Gaps in Early Education Employment, in which we also utilized the NSECE data. This research snapshot analyzes the national and selected state-level data sets from the NSECE and builds upon our analyses first included in the Early Childhood Workforce Index that Marcy highlighted. Our present analysis in this paper focused primarily on early educators working in center-based settings, although the home-based providers were included where possible. We concluded in this report that there was no singular wage gap within the early education workforce. Rather, the gaps vary across multiple factors that are inextricably linked, including, first, the funding source. For example, whether the child care center is dependent upon parent fees or publicly funded through federal Head Start, state-based public pre-K, and or child care subsidy vouchers. As well, the age of children served. For example, 86% of center-based teaching staff working with infants and toddlers earn less than $15 an hour, compared to 67% of those working only with preschool-aged children. And then the third factor was the race ethnicity of the educators. We also found, though, that the experience of teachers of color differed drastically across the United States. For example, Hispanic early educators across 3 states that we examined, which were California, Illinois, and New York, are more likely than white teachers to work as aides as assistant teachers in center-based programs as opposed to the teacher or lead teacher in that classroom. However, the proportion of Hispanic teachers in aide or assistant positions was higher in California and especially in Illinois than at the national level. So while there were wage gaps that varied by state, discernible patterns did persist in which African American and Hispanic educators endure wage gaps when compared to their white peers. So once again, we're really looking forward to the 2019 NSECE so that we can examine some of these same research questions across time and see if any of these things have changed as new policies have been implemented since 2012. So lastly, Marcy and I are going to go over some of the limitations or kind of roadblocks we hit up against as we were working with the NSECE, both analytically and then related to policy formation and assessment. So I'll just start with some analytic limitations, the first of which was sample size. So of course, in some smaller states, when we're trying to do state level analysis, we can't do a lot of analysis in states with very low population. However, even in some larger states, we couldn't answer all of the questions we looked at, for example, in our national analyses. For example, one of the relations we examined at the national level was the relation between the race of center-based teachers and the age of children with whom they worked. We were only able to extract this data for 10 states, and even amongst those 10, very few allowed us to look at race broken down to the detail that it was at the national level with all the different race categories. Another example of missing data is that some questions simply weren't asked in the NSECE of the participants, which is of course understandable because no one wants to participate in a survey that is never ending. But we did run into some issues with some missing data there. One really simple example of this is that the NSECE didn't ask home-based providers their gender, whereas they did for center-based providers. So that wasn't something we were able to see if there were differences based on the location of workers. And then I think Marcy is now going to go over some limitations related to policy formation and assessment, and then wrap up and we'll take questions.
Thank you, Bethany. So we, of course, are so delighted that the NSECE exists and that it's now will have a follow-up in a much shorter interval than we had the last time, and it really does help us get a very good picture of the workforce nationally. But and to some extent, in some of the larger states, as Bethany is referencing, but it doesn't really totally allow us to get a comprehensive picture of differences by state. And of course, we know that the workforce really does face somewhat different situations at the state level. And so why does this matter? Well, it's part because so much ECE policy is developed and implemented at the state level. So even with federal dollars like CCDF or Head Start, often what happens with those dollars at the state level is going to be influenced by whether or not the state augments financing in other ways, some of their decisions they make about qualifications and their unique licensing rules. And I think the other issue is, and this is true not just in large states like California, but getting a statewide snapshot, if you're lucky enough to do it, doesn't necessarily capture the variation. So, even some of the smaller states, if they can get a profile, have a very different situation for rural versus providers in metropolitan areas. And we know that in California, there are just really big differences around labor markets, housing, and demographic variations, and even increasingly with policy developments because, universal pre-K or pre-K at the city level now has really taken off. And so that has a big impact on a local labor market, particularly if those pre-K programs are addressing issues of parity for their participants and how that reverberates through the community. I think the other issue is that we're really happy to see that this interval was reduced because our national data at the collected, by the Bureau of Labor Statistics is so just basically gross, and I don't mean gross in a, in a judgment way, but it's just at such a gross level that it can allow us to see little differences in wages at a very high level, but it doesn't really allow us to capture differences in the community. And even over the last 7 years, if you think about in 2012, states were just recovering from the Great Recession, but now in many states and many communities, the economy is booming, and so it's a different climate that we can't totally capture, and so the 2012 data are not necessarily current enough for our purposes. And then I think the other issue that just comes up for us is this issue about how do we understand the impact of policies. And I think to understand how policies impact both, need to be assessed at pretty regular intervals, but also oftentimes those need to be, because they are local, need to be assessed at a local level. And so for that reason, and that we captured this somewhat in our data deficit paper, we've articulated a number of questions that we think that everyone who's working in this arena and doing research about the workforce and or working on early childhood research policy needs to be able to answer at not just the national level, but in a more local level. And so, for those of you who aren't familiar with it, you can look at those questions that we've articulated for people to think about in their own community. And I think that the other thing that at least our 2018 and our subsequent papers raised for us is this issue of really the need to understand what kinds of policies are being put into place to disrupt the stratification that we see, and whether or not the financing decisions in states are doing anything to reinforce or to further entrench those inequities. So we're just very excited that we have this data. We just want more data, and at many levels. And I would just say that we have tried in our studies now that we've done since the NSECE to make sure that there's sort of an alignment as best we can between the kinds of questions we ask and those that are in NSECE, so that people can understand how a local or a state looks in relationship to the national picture. So thank you very much, and I'll now turn it back to Rupa, I think, and the next set of presenters.
Great. Thank you so much, Marcy and Bethany, for your work and your comments. Brian, do we have any questions that people have written in?
No, not yet.
Okay. I would like to pose one question, Marcy and Bethany, to you. Given the limitations of the state sample sizes, as you say, did you make any attempts or do you have any comments on the idea of grouping states with like policy or like economic conditions together so that some of that policy work you're talking about is feasible, even though any given small state might not be able to be analyzed in a standalone manner?
Yeah, that's a great point, Rupa. We actually haven't done any of that analysis just because it wasn't extremely relevant to the research question that you were intending to answer. But it's obviously definitely can be done. It would be really easy to do that within the data analysis platform that you guys provide in order to look at the state level data.
Okay, thank you, Bethany. I think what we'll do is move on to Erica, and then perhaps there'll be questions for Erica or both some joint questions after we've heard both presentations.
Thank you so much, and good afternoon, everyone. My name is Erica Greenberg, and I'm here today to share some examples of how the NSECE has helped us generate new insights on early care and education providers nationwide. This will be a tale of two studies. The first is a large-scale research project examining associations between subsidy payment rates and policies and child care quality, co-authored with Julia Isaacs, Teresa Derrick Mills, Molly Mickey, and Katie Stephen Shantz, and published in 2018. The second is a quick turnaround analysis of segregation in early care and education, co-authored with Tomas Monarez and published in 2019. Both are available on the Urban Institute's website through a site search or a quick Google. So we'll start with an example from large-scale research. The goal of our first project was to identify how state subsidy payment rates and policies relate to child care quality, controlling for state characteristics. I'll describe the data sources more in a moment, but here note that subsidy rate and policy information come from the CCDF policies database and from ACF 800 data, while indicators of child care quality appear in the NSECE. This is a 3-year project supported by a generous secondary data analysis grant from OPRE, and we're grateful for their support. The project centered on 3 key research questions. The first 2 were, how much do payment rates and policies vary across states, and how much variation is there in the quality of child care centers and homes serving subsidized children? We answered these questions using summary and distributional statistics as well as correlational analysis. Our third question was, what is the association between payment rates and policies and the quality of child care providers serving subsidized children? This question called for more advanced methods, including multivariate regression analysis. The next 2 slides detail data sources for the project. Our primary data source was the NSECE. We used Level 2 restricted use geographics files, which are really Level 1 center and home-based provider files, and the workforce file, linked to Level 2 files with state identifiers. All files were accessed through the Virtual Private Network, or VPN, which required data use and non-disclosure agreements with NORC prior to access. We restricted analyses to center and listed home-based providers participating in the subsidy system, and we used 6 variables indicating care quality, along with provider and community controls. The indicators of care quality included turnover rates available only in centers, ECE-related degree or certification available only in homes, possession of a quality rating, use of a specific curriculum, financial support or paid time off for professional development, and then a quality composite we created, which is a binary variable coded 1 if providers met 2 of these last 3 indicators and 0 otherwise. Our study also included several publicly available data sources. These we compiled, cleaned, and then uploaded to the secure NSECE environment following review and approval by NORC. The CCDF policies database provided key explanatory variables in our analysis, and that database is maintained here at the Urban Institute. We were lucky enough to have database staff on and advising our team. We selected specific policies for our analysis based in part on the quality of available data and degree of policy variation across states. In doing so, we really aim to minimize disclosure risk following NSECE rules and guidance. We ultimately included subsidy reimbursement rates, use of tiered reimbursement and the payment difference between lowest and highest tiers, and a provider-friendly policy index which ranged from 0 to 4 and tallied the presence of family fee, payment for absences, payment for closings, and 12-month redetermination policies. We also cleaned and imported an additional explanatory variable from the ACF 800 data, the share of subsidies paid through contracts as opposed to vouchers. Finally, we included several control variables, ratings of licensing stringency available from NACRA, CCDF spending per child and funds from the Quality Set-Aside from the Office of Child Care, economic indicators like GDP per capita from the Bureau of Economic Analysis and poverty rate from the Current Population Survey, and enrollment in state pre-K and Head Start from here. I'll now present some high-level findings from the study focusing on research questions 2 and 3 and data from the NSECE. We observed substantial variation in provider quality nationwide. Here we're showing the share of center-based providers meeting quality indicators in blue bars and home-based providers in yellow bars. We found that 52% of centers reported a quality rating versus 60% of homes. 70% of centers reported using a specific curriculum versus 51% of homes. 70% of centers offer support for professional development versus 18% of homes, and 2/3 of centers met quality composite having at least 2 of the previous 3 components of quality, compared with 39% of homes. This composite is a key outcome in the next findings I'll share. When we ran regressions predicting child care quality with subsidy payment rates and policies net of other factors, we found that money matters for centers. A $100 increase in the base reimbursement rate is associated with a 30% higher likelihood that center-based providers will meet our quality composite. That is, that subsidies themselves may be able to boost child care quality. An additional $100 difference between payments in the lowest and highest tiers of a tiered reimbursement system is associated with a 40% higher likelihood of providers meeting our quality composite. Use of tiered reimbursement contracts and our policy composite were not significantly associated with center-based provider quality. In similar analyses focused on homes, we found that money matters for quality here too, as well as the use of contracts. There's one caveat here: findings are less reliable for homes than centers due to a smaller sample size and some differences in the available data. Home-based providers in states offering an additional $100 for providers in the highest tier under tiered reimbursement are more than twice as likely to meet the quality composite as providers in other states. A 10% increase in the share of contracted subsidies is associated with a 30% higher likelihood of meeting our quality composite. These findings are robust across a variety of different texts, and I encourage you to review the paper to learn more. Now that you've seen what it's possible to learn from the NSECE over a long time frame and with significant resources, I'll share an example of quick turnaround analysis. In Segregated from the Start, our goal was to provide the first comprehensive national comparison of segregation in early childhood and K-12 settings. To do so, we leveraged the NSECE and the universe of public and private schools included in the Common Core of Data and Private School Universe Survey. This project lasted 6 months from start to finish, but we really completed analyses in a few days. This work was supported by the Overdeck Family Foundation. Our first 2 research questions compare segregation in early and K-12 education, and then investigate variation among different types of early childhood providers. Methods here include summary and distributional statistics, as well as calculation of segregation measures common in other fields, like the dissimilarity index. This index ranges from 0 to 1 and indicates the share of children of color who would need to move programs in order for all early childhood programs to be integrated such that they mirror the attending population. Our third research question is more speculative. Our answers are still evolving and call for additional analysis, which we hope to conduct in the coming year given the critical importance of this issue. The data sources here are much more straightforward, as you might expect, than in the previous example. We simply downloaded the NSECE Public Use Center and home-based provider files from Research Connections, now the Child and Family Data Archive, and we focused on the racial and ethnic composition of children enrolled, along with provider characteristics. We restricted the analysis to providers of any type with at least 5 children enrolled to allow for the possibility of integration. And we looked at segregation in the Common Core of Data for public schools and the Private School Universe Survey to mirror the public-private nature of ECE. Here's our first set of findings comparing early childhood programs in the blue bars with kindergarten and first grade in the black bars. We find that early childhood programs are twice as likely to be highly segregated, having 0 to 10% or 90 to 100% of Black and Hispanic students, and they're less likely to be in the range of integrated programs. Now we switch to a summary measure of segregation, the dissimilarity index. We find that early childhood programs are substantially more segregated than elementary and secondary schools. In other words, our youngest learners are in the most segregated educational settings. Here we look at segregation levels by ages of served, urbanicity, and region, and we find little difference between programs that serve infants and toddlers and those that serve preschoolers. Highly urban and rural programs are similarly segregated, while moderately urban programs are somewhat more integrated. The highest levels of early childhood segregation are in the Northeast. Programs are somewhat more integrated in the South and West, and the most integrated in the Midwest. Finally, we compare home and center-based programs and find that home-based programs, both listed and unlisted, are 30% more segregated than centers and nearly as segregated as they could possibly be. We hope to unpack these findings and learn more with additional analysis, given critical implications for children's development and our collective future. I'll conclude by summing up what we've learned about ECE providers with the NSECE. First, the NSECE is the only source for learning about all providers nationwide. We could never have learned what we learned without it, and the 2019 data set will provide an exciting opportunity to examine changes in recent years. The user experience varies substantially depending on whether you're using restricted or public use files. There are obvious differences in data quality and availability, including missing values, censoring, and inclusion of geographic identifiers. There's the requirement or not of data use agreements and non-disclosure agreements in order to have access to the data. There's challenges of working within the VPN environment, including linking to other data, including publicly available data. And then there's the extraction review process, including rounding, suppression, and documentation. So while there are additional burdens in using restricted use data, there may be really important quality trade-offs, including the necessity of having geographic identifiers for many studies. At the very least, public use files offer a great opportunity to investigate emerging research ideas and determine key details that will be helpful in developing agreements to access the restricted use data. Continuing here is a general reminder that the NSECE is well documented and now really well used. So comb through the documentation, make use of existing reports from NORC, and review the emerging body of evidence based on the NSECE so that you don't have to reinvent the wheel and so that our collective body of knowledge can grow. Another insight from our work is that analyses of centers and homes are powerful. If you decide to use both, you'll want to crosswalk provider and workforce surveys early in your studies so that you can identify differences in data availability. We found matches for most topics and incorporated some variables unique to one provider file or the other, but we were glad to know sooner rather than later that the provider files are not identical. If you are collaborating with colleagues in other fields, you may have some explaining to do. This goes for all early care and education work in my experience, but just prepare to describe the field as a whole, why a survey was necessary, what the weights and sampling variables are doing, and why there are not more ECE-wide data collections. Finally, be nice to the NSECE team. If you plan to use restricted use files, Rupa, Carolina, and Brian will become valued collaborators. They're committed to upholding providers' privacy and confidentiality, and you'll need to respect their disclosure review process and timeline. They'll also cheer you on as you make use of the data they and others work so hard to collect. I'll stop there for now and then thank the NSECE team and webinar participants for listening.
Great, thank you so much, Erica. It's always so exciting for us to see the great work that people are doing. Brian, do we have questions that have come in?
I haven't received any yet.
All right, well, we do encourage folks to send in your questions. We do have a few minutes. Erica, I do have a question of my own. Could you talk a little bit about what factors you considered in choosing to include both unlisted and listed home-based providers in your segregation work? And maybe you could remind folks the difference between the two types of providers while you do that.
Sure. So listed providers are those available in administrative databases and would tend to be licensed and regulated family child care homes or large group family child care providers, whereas unlisted are those that were located through the household survey, and so maybe more informal family, friend, neighbor, or nanny caregivers. Our thought is that We wanted this to be kind of our first pass at an examination of segregation across all types of early childhood settings. We did restrict the analysis to any type of home-based provider serving at least 5 children, same for centers, just to make sure that there was at least the possibility for integration. And when we looked at differences between listed and unlisted providers, they were really negligible. So it's not that the formalization of the home-based providers explained the segregation we saw.
That's really helpful. I had not realized that. It looks like we might have a question, Brian.
We had a quick question about how the NRC team provides support around comparing home-based and center-based providers so that researchers can be very sensitive to presenting data that compares home-based providers and center-based providers in ways that are not contextualized.
That's a good question. I'll start by indicating that each data file does have its own user's guide, and in the user's guide as well as the quick tabulation manuals, we've provided a variety of resources, for example, to crosswalk individual items across the different data files, as Erica was alluding to. So we do have some tables that let you see, oh, here's where I get certification for center-based teachers. Is there an analog for that for home-based providers, and among which home-based providers would I have that variable? So there is that level of information that individuals can read. The publications that OPRE has contracted with NRC to generate, which are available either on the NSECE resources page that you can see here or on the OPRE website, provide a lot of context and kind of control totals that researchers might use. And then we would welcome further questions. You see that the nsec@norc.org email address on your screen. We frequently get questions from researchers about how to handle the data, and we are always happy to deal with specific questions. The listed home-based and center-based provider samples are drawn from the same sampling frame of administrative lists, and so the comparisons of those two data sets are quite straightforward from a statistical or sampling perspective. Obviously not necessarily from an interpretation perspective. But I might go back, I think it's Holly Tunyon who might have asked that question. And Holly, if you have additional resources that you would be interested in or that you had in mind, I don't think we can hear your voice, but if you could respond, I'd be happy to share those thoughts with the rest of the group. It looks like we have another question, Brian.
Yeah, in the meantime, we have a question for you, Erica. Did you take into account that almost all unlisted home-based child cares were related to their children when mixing listed and unlisted?
At the variables that indicate relationships between providers and the children that they cared for, and there certainly were differences when we split the analyses by those relationships. We didn't see many differences across them. And so we did certainly want to drill down a little bit beyond these two classifications and have a better sense of what's going on. I think the fact that we analyzed providers caring for at least 5 children meant that not all of those relationships were familial, but we did think that they were important to account.
The next question is a follow-up for you, Erica. Did you take neighborhood segregation into account into your analyses of segregation?
No, this was just a straightforward analysis of segregation in early care and education, but my colleague Tomas has done a lot of work on segregation in K-12 education, now in higher education and residential segregation as well. So particularly our findings around region prompted some questions about the context. And what we found was that programs in the Northeast are the most segregated of any region in the country, and that's true for K-12 education and residential segregation to some degree as well. It also may have to do with higher rates of maternal labor force participation in the Northeast of the country. And so we do want to do substantially more.
Sorry, I wanted to grab you.
I saw that, I have
We wanted to use the state identifiers in the restricted use environment at this point to be able to compare to more micro-level indicators of segregation that we have around housing, education, and other social.
Excellent. And I just wanted to take the opportunity to note that, Erica, I think your analysis did use some of the public use variables that we have about community characteristics like poverty density and urbanicity and region. There are additional, I'm not sure about poverty density actually, but there are additional variables, including those related to racial and ethnic characteristics of communities that are part of the public use file that could facilitate that work. So I think that we have come to the end of our hour. We really appreciate our speakers' time and insights and willingness to talk with us today. We are so glad to have the webinar participants. And we just want to encourage everyone to look into the NSECE resources available, and as Erica says, just Google, because there's a huge amount of great work being done with these data sets, and we would love to support and encourage as much of that work as we can. Please check out the NSECE resources, look for the 2019 data, and do write nscce@norc.org if you have any questions about working with the data or any of the NSECE publications. Thank you for joining us today.